Hello there, this is VetHub and today we are going to talk about Newcastle disease in poultry. Feel free and enjoy our presentation. Newcastle disease is a viral infection of birds and is primarily seen as an acute respiratory disease caused by an extreme strain of avian paramoxyviral serotype 1. It's highly contagious and infects the respiratory and the nervous system. It cut across through the young and the adult, and the mortality range from 0 to 100% depending on the velogenicity of the viral organism. The substrain of the virus includes the velogenic, which is the most harmful, mesogenic, the moderate harmful, and the lentogenic, that is the least harmful. The velogenic is mostly found in Africa and Asia continent. The disease is passed from chick to another by inhalation or ingestion. Inhalation is where the birds exhale the viral to the surrounding, and via ingestion is through the fecal oral route. When the unaffected birds come through to contact with the feces of the affected, and by mistake they ingest it, they get affected also by the virus. And the virus is shared to the surrounding during the incubation period. This is when the chickens are affected, but they show no signs of the disease. Through the clinical stage, this is where the stage where we see the sign, we start seeing the signs of the diseases expressing itself into the body of the poultry. And after recovery, even when the birds recover, they still have the active form of virus in their body, and they can be passed through to the unaffected. Examples of poultry include chicks, ducks, turkey, pigeons, but chickens are the most susceptible to this virus. Symptoms of Newcastle disease. We have three strains that cause this disease: lentogenic, mesogenic, and velogenic. Velogenic is the most harmful, lentogenic is the least harmful. Mesogenic is the moderate harmful strain of the disease. Velogenic strain. Velogenic strain causes severe and sometimes lethal disease in poultry. The clinical picture include respiratory signs that may be followed by nervous symptoms. Birds appear to be lethargic, that is, they appear to be lazy or lack energy. The feathers appear to be ruffled. The birds also appear to be running out of air, condition known as dyspnea. The skin of the birds can appear to be bluish in color. This is because they lack oxygen in their system. There can also be diarrhea that is usually greenish or watery. The nervous signs. The first is tremors, the second spasm, the third paralysis of the wings and legs. The neck of the bird can also appear to be stiff and painful to turn. There can also be swelling on the neck. The bird also appear to be moving in circles. There will be also sharp or decrease or complete stop of egg production in the flock. When eggs are laid, they appear to be abnormal in color, shape, and surface, i.e., they are rough, or the egg will have thin eggshell. The albumen will also appear to be watery. The velogenic strain will result in sudden death. The morbidity and mortality can go as high as 100% on unvaccinated flock. The lentogenic and mesogenic stage. The lentogenic strain usually linked with subclinical disease that may include non-severe respiratory sign and minimal mortality. Respiratory signs include gasping, coughing, sneezing, rattling, or wheezy sound from the lungs. The mesogenic strain may cause an acute respiratory disease with nervous symptoms sometimes. There will also be a decrease in egg production and mortalities that are usually less than 10%. The lentogenic and mesogenic strain can sometimes strike together, leading to high amount of mortality. This will be more than 10%. For the surviving flock, when they are attacked by the velogenic strain, they will appear to have permanent neurological damage, and also there will be an insistent decrease in egg production. Vaccinated bird may not show any signs of this disease, except there will be decrease in egg production. Postmortem analysis of affected flock. Lesions are usually seen on birds affected by velogenic strain of the virus. Sometimes birds with neurological sign or that die suddenly show few or no gross lesions. The different part where you are expected to see lesion are listed there. You can pass over them. The lesion caused by lentogenic strain are usually limited to congestion and mucous exudents in the respiratory tract, with opacity and thickening of the air sac. You can see there we have the gizzard there with swellings, the red swellings that are pointed by the arrow, and the swelling are usually of less than 2 mm. So that is all I can say about the postmortem analysis of the affected flock. But majorly, the velogenic strain are the most that cause lesions in the affected flock. Control of Newcastle disease. Newcastle disease is a viral infection, and we have no drug for this disease. The only way of controlling Newcastle disease is via vaccination and proper biosecurity measures. The different types of vaccines are live attenuated. The examples are listed there. That can be administered via drinking water, spraying, or via eye drops. Inactivated vaccine. These are majorly given as boosts to support the live vaccine, and they are majorly given in endemic areas. Vaccination against Newcastle disease should be adopted to the field and challenging conditions. A note: vaccine protect clinical sign and minimizes the loss, but the Newcastle vaccine does not protect against infection or virus shedding. Vaccine failure is usually a consequence of bad administration, leading to significant percentage of the flock not immunized. The notice being given here is that when you are giving this vaccine, ensure that majority of your flocks receive the vaccine so that you can accomplish what is called a herd immunity, so that whenever there's an infection in your area, your majority of your birds can survive through the infection. Biosecurity. Biosecurity is another method that we can control Newcastle disease. And the plans biosecurity majorly means preventing a disease causing agent from entering or leaving a place. Here we are majorly concerned in preventing the Newcastle disease from entering our poultry farm. And the plans may include pest control that may carry the pathogen from into entering the flock. Yeah, the pests like rodents and insects can carry the pathogen and bring it into the poultry farm. Separation of farm, feed and water supply of the wild birds, control of human and vehicle traffic on and off the facility, and strict disinfection of equipments entering the farm. We can do this by having well baths at the gates where the vehicles may be entering the farm, and the human traffic. Not everyone should be allowed to access the poultry farm. A workers policy like shower in and dedicating clothes. This is where when you want to enter the, the poultry unit, you have to shower, and you need to have dedicated clothes that remain in the facility, where when you enter there you have to put on this cloth specifically, so that you don't carry the pathogen from outside there and you are bringing it inside into the farm. They perform the all out system to avoid contact with groups of different ages. This means that when you cull the birds, or when you have birds, ensure that you have birds of the same age, and when you cull them all at once, so that when you have new flocks coming in, they can't be affected by the previous flock, or the new flocks can't bring in the diseases to their existing flock. And disinfection also can also be done via use of formalin. This is when you have foot bath in the entrances, or you can disinfect the litter if you are doing deep litter system. You can infect with either formalin, that phenolics, and oxidizing agent Chlorine and also sodium hypochlorite can also be used for disinfection. The virus can also be inactivated by heat treatment. This is majorly on the equipment. The equipment can be washed via hot water that can naturally destroy the virus. Diagnosis of Newcastle disease. This is where we want to make sure that whatever is affecting the flock is Newcastle disease. Just by doing a postmortem or looking at the lesions doesn't mean that that disease is Newcastle. Here we want to be sure that the disease is Newcastle. This is where we want to do the diagnosis. Clinical signs are not the most reliable basis of diagnosis Newcastle disease. And also the lesions can be caused by different disease. Isolation of the strain that cause Newcastle from live or dead birds are the best way to diagnose Newcastle disease. This can be attained by obtaining swab from the tracheum, since Newcastle is a respiratory disease, and also the tissues and spleen can also be taken, and swabs may be taken from these regions, and they can be taken to the laboratory where tests can be done. Several tests are listed there that can be used to detect Newcastle disease. One can also do sequencing, which is where the DNA of the virus is tried to be seen, to be detected. The whole genome sequence can be done for identification of the virus, since the DNA or the DNA sequence of the virus is known. When you do the genome sequencing, you can be able to identify the virus. That is all about the Newcastle disease, and thank you for your time.